An organization called the Denver Basic Income Project, or DBIP, has been conducting a study in which around 800 homeless people are given a guaranteed income. Now, the money seems to have helped some of the participants find housing and get a little bit of financial security in their lives. But the study also reports that some have experienced worse mental health, which we're gonna get to in a little bit. But first, I wanna focus on the methodology of this study, how much money these individuals were given, and what the results have been so far. So here's what you need to know. The study basically followed 802 homeless adults. Homelessness was defined by the study as individuals without fixed, regular, and adequate nighttime residence. So not everyone was living on the streets. We're talking about people who could be crashing on someone's couch, maybe staying in shelters. Now, it's important to keep in mind that individuals with severe and unaddressed mental health issues and or substance abuse issues were not eligible for this study. So they are not included in the sample. And that is important to keep in mind, because when we talk about how to kind of structure our social safety net, having a one-size-fits-all policy like UBI is not gonna cut it, right? I think that you do need like this mosaic of different programs that address various needs. So, also important note is that not every participant in this study got the same amount of money. They actually divided them up in 3 subgroups. So group A is receiving $1,000 a month for 12 months, which of course totals $12,000 a year. The second group starts off with a lump sum of $6,500, and then they get another $500 a month after that for a year, okay? Again, totals to $12,000. And then group C gets far less. They get $50 a month for 12 months. So they only get a total of $600. Now, the study was intended to follow the participants for a full year, but they decided to release an interim report with the data coming from the first 6 months of the study. And so how did the data turn out? It's really fascinating. Let's take a look at this first graph. It'll show you how the participants had an easier time finding housing of their own. So they're living in an apartment that they rent or own. Before the study, about 8% of them, basically for group A, I should say, the number increased from 8% to 34%. In group B, these are the individuals who got the lump sum and then $500 a month after that. You see the biggest increase in housing going from 5% to 40%. And even in group C, which only received $50 a month, the number increased from 11 to 31%, which is kind of incredible. So conversely, the number of participants sleeping in a shelter decreased following 6 months of this study, and that is what you are seeing in this graph. So in group A, the number decreased from 22% to 11%. In group B, the number decreased from 26% to 10%. And in group C, the number decreased from 21% to 9%. And then finally, the number of people sleeping outside in Denver also dropped as a result of this. So for group A, it went from 6% to 0%. Group B, 10% to 3%. And in group C, you see the number going from 8% to 4%. So universal basic income obviously has some positive benefits here. The way that it's implemented, should it become a widespread policy, really does matter. I think that there are, the devil's in the details, but nonetheless, this is certainly promising information. And by the way, the reason why I say that is because, these are also individuals who happen to be receiving other government benefits, right? So it's not that they're receiving no help at all, and they're just getting this one-time payment every month, or the lump sum and then the $500 every month after that. No. They're getting other government services in addition to that, and some of them are also working. A lot of them are working part-time jobs, or they're borrowing money from a friend. So you can't really look at UBI in a vacuum. When you look at this sample, you can tell that there are other forms of financial aid they're receiving.
So whenever you give people who really need money, some degree of money, it makes a giant difference in their lives. A good example of that is the child tax credit. So it happened in the first year of Biden's term, and reduced child poverty by a stunning number. I forget exactly what it was now, as we covered a couple of years ago. But it was a number that was just shocking, because it turns out those are the people that were right on the edge. And when they got the child tax credit, it allowed them to take care of their children and have a little bit left over, et cetera. They made a big difference in their lives. Part of the reason, by the way, why wages went up too, because it gave them the freedom to be able to look for a job that paid better, et cetera. There's so many different factors that go into it. Now, I've always been a little bit skeptical of universal basic income, because I'm worried that it's a short-term fix, and can we really keep it going, and how long can we keep it going? And I wouldn't want it, so some programs are better when you give it to everyone, like Social Security, because if you don't give it to the rich, then they go, well, then we don't want it, and they cut all the funding, and that happened with public schools, for example. But with universal basic income, whenever I've seen any study, and there was a different one in Northern California once, where you try and give it to just the right people, right? The people who can use it and really need it, it makes a big impact in their lives, and you can see it in the numbers. So it makes me more open-minded towards universal basic income, because this is good data. Now, at the same time, it's just the beginning. We have to see how long it lasts, especially for anything that's temporary. Does it stick, right? And how, or do you have to keep on giving the money? And at some point do they rise above it, et cetera? So there's so many things to track. I don't think this data is enough to say that's it, we should all definitely do it. But at the same time, it's definitely good news for this program. It wound up helping a lot of people.
Yeah, and look, I have a little bit of a bone to pick on how this was reported on Business Insider, because Business Insider, their takeaway was, you see, people like to blame homelessness on drug addiction and mental health issues, but in reality, people just need money, right? Like that was the point that they were trying to make. No, but this study literally said people with mental health issues and drug addiction problems are not eligible to participate in this study. And I mention that because homelessness, I know some people get real offended by this, even though it's just the reality. Homelessness is a complex issue. For some people, it's because of the unaffordable nature of housing, it's because of the housing crisis. For some people, it actually is because they have severe mental health issues and they don't even know what's going on, right? They're just, they're not even cognizant of the surroundings that they're existing in. I mean, you see it every single day. And then there are people who are struggling with drug addiction. So the only problem I have is when UBI is presented as like the end all be all, one size fits all approach, when in reality, it could be a part of the puzzle that really does help improve people's lives. But it is also important to address homelessness and the complexities involved in homelessness as well. You get what I'm saying?
Yeah, 100%. Look, guys, common sense, man. And sometimes our ideologies or the preset ideologies from decades ago block us from using normal human judgment and common sense. So if you give this money to folks who are right on the edge of poverty, but that are the working poor or getting back up on their feet, et cetera, of course it could help them a lot. If you give it to someone who's got a massive drug addiction, guess what they're gonna do with it? They're gonna buy more drugs. So if you're on the left and you think, no, you're besmirching the character of drug addicts. Come on, guys, I love your brothers and sisters, but facts are facts, and this obvious. Look, they're in the midst of an addiction, they need help,
yes,
right?
Yep.
But just giving them money is not the help they need in that particular case. So of course it depends on the situation. If someone's not mentally well, I mean, do they even know what the money is? Do they know what to do with the money? Are they gonna use it in a productive way? Come on, don't be ridiculous.
And the other thing,
so there's other ways to help them, not this though.
Right, and the other thing to keep in mind is that in order to participate in this study, you'd have to apply for it, right? So there's a little bit of a sampling issue with the methodology here, but that doesn't matter. Like, I still think that there are promising results here. I do think that, again, as part of a puzzle, basic income can be part of this solution. And so it looks promising, and these types of results have been replicated in other jurisdictions, other cities that have tried it out. So let's keep the data flowing, let's keep experimenting with it, because we do need to think about out of the box solutions. I mean, out of the box in the context of the United States, to deal with the economic stresses that Americans are facing.
Yeah, last thing I'll say on it is, it also shows you that if you target right and you get to the people who need help and want help and can use help, they do use it.
Yeah.
And that's wonderful, right? And it does help them. So that means no, not the government programs are not all waste. If you do it right, you'll get to the people who really need the help, and it'll be wonderful.
And now I promised one kind of surprising result of the study that I wanted to share with you, and that has to do with mental health. So they asked the study participants how they're doing in regard to mental health. It was measured on a scale of 1 to 10, with 1 representing poor mental health and 10 representing excellent mental health. Here's how the measurements changed. So as you can see, for every single group, they reported their mental health declining, despite the fact that they were, able to secure housing for themselves. Their economic situation felt more secure. And so the people behind the study suggested one possible explanation, which I do think makes a bit of sense. So they asked them how their mental health is right as they're accepted to participate in the study, and they know they're about to get some cold hard cash. They're probably elated and relieved about that. And then, that excitement probably kind of tapers off a little bit. So maybe that's the explanation, who knows?
Look, or when you have a house, you have more stress, or apartment, etc. I mean, who knows? But I'm not, those numbers are not dramatic, so I'm not overly concerned about it. I don't think by materially improving their lives, I don't think we're stressing them out too much.
Agreed, yeah.
My guess is if you ask them, they'd be like, no, I'll deal with the stress, you give me the money.
Thanks for watching the video, guys. We also love it if you hit the join button below, because that makes you a member, and members allow us to be independent, honest. We can be as progressive as we want, no corporate media influence, and that's all because of you guys. We love doing the show with our members. Hit the join button, become one of the Young Turks.